Welcome back. Continuing the news. An exchange program between the Philippines and Jamaica is among some of the solutions being put forward to improve the human resource challenges in the public healthcare system. Philippines Health Secretary, who is on the island, revealed that both countries could benefit from a bilateral agreement that's expected to be signed over the next 3 days. Jamila Maitland picks up the story.
We are hoping over the next 3 days to sign an MOU around some common sharing of ideas, technical support.
Health and Wellness Minister Dr. Christopher Tufton after welcoming health officials from the Philippines on Monday. The Philippines is the largest exporter of nurses worldwide. The country's Health Secretary Ted Herbosa revealed that it trains 10,000 nurses annually. 13,000 nurses migrate. The gap created by this has no doubt impacted the delivery of healthcare services to its 117 million people. Mr. Herbosa says by creating policies that benefit both the sending and receiving markets, the healthcare systems can be more self-sufficient.
Clinical side of nursing is just the actual face-to-face part. But a lot of the didactics and the learning can be done online. So I'm thinking of blended methods to be able to bridge the long divide between the Philippines and Jamaica. And then there's also the concept of our nurses coming here, our senior nurses, training more people here with the experience they have. So faculty and trainee exchange. And the same with doctors and everything.
Chief Medical Officer Dr. Jacqueline Bisesa McKenzie, who was on a working trip in the Philippines last year, says the country, though significantly larger than Jamaica, has similar challenges. She says the ministry is looking to adapt some of the policies surrounding hospital and equipment management, as well as maintenance. The CMO revealed that visitation at public health facilities is also being reviewed.
They had a policy that allowed visitors to stay with the patients right throughout, and that allowed for less staffing needed on the wards. You know, it made a huge difference. But managing it with our population, you know, it's going to require some training. They do have training of their visitors coming in. But I think, though, that there is a difference in terms of our attitudes and our behaviors that we would have to work it in slowly to see how it is that we can use that to help to alleviate some of the problems that we have.
Of equal importance is the culture of service in the Philippines. Like Jamaica, the healthcare workers there also complain about salaries and benefits. But the CMO says with a national focus on improved quality of life for all, a healthy balance can be struck while carrying out their duties.
Having that culture of customer service makes such a huge difference. Because the difference that we saw was that with even less than us, they are able to do more in some situations simply because of that culture of, you know, how they deal with one another.
Jamila Maitland, TVJ News.